Three. Uh, Good afternoon, everyone. I'm Dr. Poornima Mathur from Oasis Fertility Vadodara. आज फिर हम आपके लिए एक टॉपिक लाए हैं, समथिंग टू डिस्कस, समथिंग जिसके बारे में भी टॉक्ड अर्लियर, और आज हम उसको थोड़ा सा डिटेल में कवर अप करने जा रहे हैं इन सर्टेन पार्ट्स. सो वी ऑल नो दैट हमने पहले डिस्कस किया फर्टिलिटी प्रिजर्वेशन, द बायोलॉजिकल क्लॉक, हाउ कैन वी एक्चुअली कंट्रोल थिंग्स व्हेन वी हैव अ करियर वर्सेस फर्टिलिटी ऑप्शन. आज हम एग फ्रीजिंग के बारे में थोड़ा सा डिटेल में बात करेंगे. लॉट हैज बीन सेड अबाउट इट ऑन सोशल मीडिया. सो एग फ्रीजिंग बेसिकली हमें पता है ये हमारे एग्स को, जो हमारी फर्टिलिटी मतलब एग्स को फ्रीज करने का मेथड है, वेयर वी कैन फ्रीज देम एंड यूज इट एट अ लेटर स्टेज ऑफ आवर लाइफ जब हमें उसकी जरूरत हो. बहुत सारे इंडिकेशंस हो सकते हैं हमारे मेडिकल एंड नॉन मेडिकल. वील फोकस मोर ऑन द नॉन मेडिकल वंस दिस टाइम. द नॉन मेडिकल वंस, अगर हमें पता है कि वी आर गोइंग टू गो अंडरगो एन ओवेरियन सर्जरी, अगर हमारी we have our career sorted out now, somewhere around 25 to 30 के बीच में is where we get an idea how is our career heading and what exactly do you have in pipeline for you, कि हमारे career पे हमें कितना work करने की ज़रूरत है, when are we going to meet our partner, do we have someone right now, अगर है so when are you looking forward to having a pregnancy. So these personal reasons जो हैं, they would be an indication for egg freezing, so that you have the liberty to take a call according to your priorities. आपकी इच्छा के अकॉर्डिंग आप डिसाइड कर सकते हो. सो वन इज कि हमें आइडियली एग फ्रीजिंग कब करना चाहिए. सो देयर इज वन इज कि जब हमें याद आया है कि ओके फाइन, यू रियलाइज एट द एज ऑफ 35 36 हमारी हो गई है, एंड वी नो दैट अभी फॉर वट एवर रीजन वी आर नॉट लुकिंग फॉरवर्ड टू प्रेगनेंसी फॉर अ कपल ऑफ ईयर्स मोर. So the sooner it clicks to your mind, the sooner you report to the fertility center, the better it is. But अगर हमारे ideal age, अगर आपने किसी को advise करना है, somebody maybe your sisters, your friends or your daughters, तो ideal age would be हमारी 20s to early 30s. That is when हमारी fertility at peak होती है, egg quality हमारी सबसे अच्छी होती है. And what we want is when we are saving something for our future, it better be something that is good. And जो हमें थोड़ी सी ज़्यादा assurance दे that we would be able to get there and get our desired outcome. So the best age would be when you are in your 20s. Say for instance late 20s, when you've started working, you see okay fine, I have a very good career going on and I don't think I can take a break sometime soon. That is where you get your fertility assessed and go ahead with the fertility planning and fertility preservation. Early 30s is also an ideal time. So see, we can say between 25 to 35 would be the right time जब हमारी आप fertility preservation के बारे में सोच सकते हो. Why is so much being talked about? Because we normally expect कि fertility वाला problem ये एक कम हो रहा है, वो आएगा around 40s where somebody would inquire it, would actually face it. 35 के बाद जो 38 40 में है तब ये सारी problem शुरू होती है. But owing to our lifestyle, जो हमारे patterns हैं, the stress that we are exposed to, हमारे environment में जो pollution रहती है, the microplastics that we are continuously exposed, all these things have had a major impact on fertility, both men and women alike. So it is not uncommon for us to meet young girls in the age of 28, 29, 30 struggling with a very poor ovarian reserve. I personally feel it is should be strongly recommended कि जैसे हम regular health checkup करते हैं, उसी health checkup में all young girls should get their fertility tested so that they can plan their things accordingly. They know whether how soon do they need to go ahead with the fertility preservation. Or somebody who has, say for instance, somebody is looking forward to a pregnancy at the age of 31, 32 only. She would say, I'm not planning it very late, so I don't think I'm an ideal candidate for fertility preservation. But as we say, agar आप 24, 25 पे you finish your college, you think you'll be starting your career, as a routine screening, you go ahead and get your AMH levels done. AMH levels जो guide करता है हमारा fertility potential क्या है. Now, if they are lower range, maybe they are around 1, 1.5, less than 1, that is where you know, even at the age of 31, where I'm too young to have a baby, all is in sync, but still हमें struggles आ सकते हैं from the perspective of the low egg reserve. So the ideal age, though हम कहेंगे 25 to 35, and but still we have to take into consideration कि an AMH test and at young age would guide the young girls better into this direction. सो हमारे स्टेप्स क्या होते हैं नाउ से फॉर इंस्टेंस यू डिसाइड कि ओके फाइन मैम I think I should go ahead with fertility preservation. I am 29. I don't see myself settling down anytime soon. So the first is you go and meet a fertility specialist. You because it is a very important thing that you have an informed decision. You understand what you are going to go through. आपकी appointments कितनी आएंगी, how much work time आपका loss होगा. So initial counseling के बाद when you're comfortable with the doctor would initially order you a certain amount of blood tests, एक ultrasound, an ultrasound which would tell us कि how are your ovaries at that moment, how is your uterus, any other adnexal pathology. तो वो सब कुछ एक बार डॉक्टर एक अल्ट्रासाउंड और फ्यू ब्लड टेस्ट से हम असेस करेंगे. वंस वी हैव डन दैट, उसमें एक बहुत ही इंपॉर्टेंट टेस्ट है जो सीरम एएमएच. सीरम एएमएच दैट टेल्स अस हाउ इज योर फर्टिलिटी पोटेंशियल, कि हमारे ओवरीज में कितने एग्स हैं, बिकॉज दैट इज वेरी इंपॉर्टेंट टू नो टू गेट अ वेरी रियलिस्टिक पिक्चर हाउ मेनी एग्स वी आर गोइंग टू क्रायो प्रिजर्व एट अ पॉइंट, कितने एग्स एक्सपेक्टेड है. द अल्ट्रासाउंड उसी चीज को रीइंफोर्स करेगा इन द फॉर्म ऑफ द इंट्रल फॉलिकुलर काउंट जो हमें पता चलेगा. So now after understanding initial counseling, there will be a few blood tests. Now after you've decided, the stimulation जो हमें है कि egg freezing का procedure would start from the second day of your periods. So there would be certain medications, certain blood tests, all would be done before the periods. On second day, you undergo an ultrasound and you start with gonadotropins injection. अब ये गोनाडोट्रोपिन्स जो हैं ये हार्मोन्स होते हैं. ये हार्मोन्स आपकी बॉडी में होते हैं एवरी टाइम, लाइक एवरी टाइम आपको साइकिल आएगी आपकी बॉडी में हार्मोन्स आएंगे, मे बी ऑन अ लोअर डोज, बिकॉज हमारी नेचुरल साइकिल में वी हैव वन एग फॉर्मिंग. नो इसी हार्मोन के लेवल को हम सिर्फ बढ़ाते हैं इन द फॉर्म ऑफ इंजेक्शंस. Now the question comes, are they safe? Is it too painful? Do I have a long-term effect? So these hormones are physiologically there in your body. The dosage that is given and the duration for which it is given, जो हम डोज दे रहे हैं और जितने 10 days के लिए दे रहे हैं, in that dosage or duration it does not majorly cause any physical or medical complication. The medical complication, like it is always important कि जब भी कोई किसी procedure को start करते हैं, whether it is an IVF or a fertility preservation, उससे पहले it is important to have a medical checkup where we know that you do not have any existing comorbidity which can impact the effect of the injections. Now वो injections जो हैं they do not have a long term effect. They very small dosage, तो इतने painful नहीं होते हैं. So now they definitely have a fixed time where we are giving it. Now, say for instance, you're taking it every day at around 10 o'clock. So we will have a plus minus 5 to 10 minutes at the fixed time. So ये second day से अगर आपका periods आ जाते हैं, periods की second day से the injections would start after an initial assessment ultrasound के साथ. ये डोज हर किसी के लिए सेम नहीं होती. किसी को हो सकता है सिर्फ 225 इंटरनेशनल यूनिट चाहिए, किसी को 250, किसी को 300. ये डोज डिपेंड करेगी आपकी एज के ऊपर, आपके बॉडी वेट के ऊपर, हाइट के अकॉर्डिंग द बीएमआई, एंड आपके एएमएच के ऊपर. वंस आपके इंजेक्शन स्टार्ट होते हैं टू मेक द एग्स, दे आर रूटीनली मॉनिटर्ड विद द हेल्प ऑफ अल्ट्रासाउंड. Now this would not need too much time in the clinic. Now if you are a working professional, आप second day आते हो, get a scan, you get an injection, that would be half an hour affair. इसके बाद you can continue working, going to your office, attending your meetings, everything. You can travel provided you take your injections on time, you can manage that. After that, we would have in the entire procedure 3 or 4 consultations where हम आपके scan करते हैं and we titrate the dose. During all these procedures, आपको कोई छुट्टी नहीं चाहिए. It is 15 minutes consultation. जब आपको scan होके we can give you the injection and you can continue your routine day-to-day work. Workouts अगर होता है, so it's like if you have an extensive strenuous gym workout, so that might be restricted. हम उसको थोड़ा सा restrict करेंगे so as to give your ovaries a little rest. Heavy jerky exercise, strenuous abdominal workout, they are to be avoided. Walk and everything can be continued. So अगर हम देखें इन 10 days में हमारा मेजर फर्क नहीं पड़ता. The office continues as usual. Take your injections. When the eggs, when the follicles are ready, you're giving even an injection and हम ये oocytes को बाहर निकालते हैं. Now how are they taken out? So this दो हम कहते हैं it is a surgical procedure, but इसमें कोई ऊपर कट या ऐसी कोई सर्जरी नहीं होती है. द वे एक ट्रांसवेजाइनल अल्ट्रासाउंड होता है, उसी प्रोब के थ्रू we needle say we aspirate the follicles out, and this is all done under anesthesia. So the only thing that you remember is I went into the OT and I slept off. When you come out, you realize the procedure has been done already, and it is a daycare procedure. It does not require entire night in the hospital. You come at 9 in the morning, you leave by 5 in the evening. There is no cut, ऊपर कोई cut या stitches नहीं होते हैं. And once the eggs are taken out, you can the procedure is almost done. Now comes our part only. जो हमारे eggs हैं, they are assessed in the lab. Why are they assessed in the lab? Because we need to see what is the quality, what is the maturity. Maturity, क्योंकि जो eggs हैं जो हमारी ovaries में होते हैं, they mostly all are in a dormant stage, जिसमें से every month एक egg mature होता है and is released. Now the eggs are at different stages of maturity: a GV stage, M1 stage, M2 stage. So now it is the M2 oocyte or the metaphase 2 oocyte या egg जो हम कहते हैं, अगर हमारा egg M2 की stage पे होता है, that is used for making a baby and fertilization के लिए. So the M2 oocytes आपकी जो eggs निकलते हैं, for instance if we have 10 eggs, उन 10 eggs को हम देखते हैं, the mature eggs 8 है, these are eligible for freezing. So now cryopreservation of oocytes is a very delicate procedure जो हमारे सिर्फ experts embryologists करते हैं, so as to ensure कि हमारा retrieval जब आगे हमारा usage हो तब हमारा oocytes का survival बहुत अच्छा हो. Now initially अगर हम पुराने टाइम में देखेंगे, the oocyte survival was a major challenge for us, but with the latest advances in the vitrification process, we at Oasis have almost a 90% survival of cryopreserved oocytes. 90% सर्वाइवल का मतलब मैं अगर आपको समझाऊं तो इस लाइक आज अगर हम 10 एग्स को फ्रीज करते हैं, 10 M2 oocytes को, एंड से 7 years डाउन द लाइन यू डिसाइड कि आई नीड माय oocytes कि मैं उससे एम्ब्रियो बना सकूं. नाउ रिमेंबर देयर इज अ डिफरेंस बिटवीन एग्स और एम्ब्रियो. एम्ब्रियो जो होता है वो एग और स्पर्म से मिल के बनता है. दैट इज आप लेडी का एग, मेल का स्पर्म, ये मिल के जो बेबी बनाते हैं, दैट इज नोन एज एम्ब्रियो. एंड these are अगर कोई married couple है who want to have their egg preservation or fertility preservation, they can preserve their embryos. Now as a single lady I would go ahead with egg preservation. So when I need it, मैं ये 10 eggs लूंगी, they would be thawed. सो अर्लियर स्टेजेस में ऐसा होता था कि 10 में से हमें 10 नहीं मिल पाते थे, किसी को 6 बाहर रिट्रीव हो पा रहे हैं, 5 हो रहे हैं, बट ऑफ लेट द एडवांसेस आर सच गुड कि हम 10 में से 9, 10 में से 8 हम क्रायोप्रिजर्व oocytes को यूज कर पा रहे थे, अवेलेबल फॉर यूज. वंस उनको हम बाहर निकालते हैं, उनको थॉ करते हैं, दैट इज उनको नॉर्मल उसमें लेके आते हैं फ्रॉम दैट सर्वाइवल फ्रॉम द क्रायोप्रिजर्व स्टेट, फिर पार्टनर का स्पर्म इज इंजेक्टेड इनटू इट to make the embryo. Now when we are preserving the oocytes, उसका मतलब ये नहीं है कि my subsequent pregnancies IVF से ही होगी. This is just a backup plan that आप अपने पास ready रख रहे हो कि okay, right now at the age of 30 मुझे pregnancy नहीं चाहिए. What if 38 में मुझे pregnancy चाहिए? Now at the age of 38 you try naturally. If you conceive well and good, you still have the backup. You can use it for your second child or your third child. If in case at the age of 38 you are struggling with fertility, आपको नहीं हो रही है pregnancy and you decide कि okay fine अब नहीं हो रहा है for whatever reasons, my eggs have diminished or for other reasons, tubal blockage or whatever, that मेरे को IVF करना पड़ेगा. So the 30 years की age वाली oocytes would help us out now. If it is at the age of 40 where we are very sure कि eggs में genetic problem होने की chances high होते हैं, we use those 30 years cryopreserved oocytes to give us a better quality embryo. So अगर मैंने oocyte cryopreservation कराया हुआ है in my early 30s or late 20s and I need to have a baby at the age of 40, for me I can use my eggs instead of going ahead with a donor oocyte. So you have to keep this in mind that this oocyte cryopreservation is very it helps women take control of their life, plan their career accordingly, And it does not necessarily mean that you would have, like, you can always try for a natural pregnancy before you use these cryopreserved oocytes. You should, all young women, it's like it would be a sincere appeal from my side कि आप young हो, you starting your career, आप routine health checkup कराते when you join an office, please get a serum AMH test done. ये AMH test आपको guide करेगा regarding how should you proceed later on for the fertility. So, if you, we'll discuss the procedure with videos in detail in our next Facebook live session. If you have any queries right now, please feel free to ask. How many eggs should be frozen to increase the chances of successful pregnancy later? So the number of eggs that need to be frozen. So I had kept this for the next book, but I'll answer it. So वैसे अगर हमारा if somewhere between 10 to 20 हमारे eggs cryopreserved होते हैं, that would ensure us a good embryo and a pregnancy later on. But it all depends upon the age at which you are freezing the eggs, the quality of the eggs that we get. What are success rates for using frozen eggs to achieve pregnancy? So the cryopreserved oocyte survival has significantly increased to 90% at our centers. So it would have a good success rate to achieve pregnancy if done at the right age. Are there any health risks or side effects? So we've discussed this in detail during our during our talk. Ki there's no major side effects per se. Now, if I say the I've discussed the injections are very small amount. They are usually routine gonadotropin dosage. The duration and the amount of injections for which they're given, they would not cause a major long-term effect. So there is no major complication or health risk associated with it. So please, if you have any queries, please reach us out on the helpline. And I can see Lakshmi has got an IUI done in the chat box. Lakshmi, all the best. Hopefully you would conceive in this cycle. Thank you so much.